It's always nice to have warm oil, so if there's any way possible you can have something to warm your oil with, please do. Bottle warmers work great. They make them just for warming oil. Crock pots work good. Electric skillets work good. Just do something to help you keep the warmth of your oil. I like these type of bottles because I can control it with one hand. Flip the top with one hand. And I can keep where the oil goes over the table. If you're wearing a holster or with the pump, you really can't. You're pumping it into your fingers and it gets everywhere. Trust me, it does. It's very, very difficult to do it that way. Plus it gives. Every time you push it kind of gives. Now you can wear scrubs like I do so you have pockets, or you can wear an apron so you have pockets, or you can place your oil somewhere handy so that you can get to it easy. That is not here. Okay, you never go into the hip area. So I'm going to put this, make a little well for it back here against that bolster. Now I could wrap that in a washcloth if I feel that it might leak, and with a washcloth wrapped around it, it's going to hold the warmth in, so you may want to do that. Get a washcloth and just learn to put your oil into that washcloth. You can start this wherever you'd like, but just remember you're coming into their space and there needs to be some contact between you and the person on the table to introduce yourself. You can simply hold them at their hara or on their chakras. And what I like to do is ask them, take a nice deep breath in for me and blow it out. And as they exhale, I exhale with them and I apply the oil. Now as I get more oil, I can hold their hara with my palm, resting hand position, and apply more oil. So I kind of combined the two. Now we're going to come back and we're going to apply this everywhere we're going to work. And remember, your massage started the minute you said hello to that person. So this is part of the massage too. You think you're not massaging yet because you're just applying the oil, but you are. The whole gestalt is what the person experiences, and that started the minute you said hello to them. While you're working, same rules apply. Keep those elbows down to your side while you're working. Every move you make, you want to keep your wrists flat. You never really want to go up to 90, because think of what you're doing. You're crushing those nerves in your wrist every time you do this. You put pressure against it, it's even worse. And you don't have to do it, so don't do it. There's no need to do it. If I want to stroke down, I get closer and I flatten out my hands. I flatten them out. Where your power comes from is your back leg. So your back leg never leaves the ground. You're always pushing against it, so that's where your power comes from. So that back leg is your anchor to the earth. It's your anchor. So you keep that planted securely on the ground, and you keep all of your work flowing from that back leg up and into your hands. You don't want to stroke so far away from the body that you lose your power from that back leg. So you're going to take some steps forward if you need to. You should never go so far away from that back leg that you lose your balance. And you're going to use your body like an A, like a fulcrum. So it's coming up from the back leg and into the opposite hand. And I should have enough balance to where I can pick up the front leg and the back hand and not lose my balance. So if I go out So that right there, I still have balance, I still have power, but if I go any further, I don't. So I need to keep it close. And you notice when my elbows are at my side, it's me, my body, doing the work. It's not my muscles, it's not my shoulders, it's my back and my legs. So now I need to work on his arms too, right? So I'm just going to pick his arm up and swing it back to the table. You want to try to keep contact at all times. You don't necessarily have to, because sometimes those little breaks gives the body a chance to assimilate what it's experienced, and they can become part of the massage. But you have to make sure that it is part of the massage. So don't just take your hands off abruptly and don't do anything or say anything, because after about 10 seconds, they're going to wonder what happened to you. Now, they're no longer in their alpha dreaming state. They had to come back to beta. They had to pay attention to their surroundings, and they had to look for you. You never want them to do that. So you can usually do that by keeping that space the same length of time that you had done your work with your hands on them. So everywhere I'm going to work, I need to get the surface prepared so that I can go there and work. Now what I'm using is fractionated coconut oil. It's what we call a dry oil. It has wonderful glide, and you don't need that much. If you can see on the video how his skin is not shiny, it glistens. That's all you need. For a Swedish or deep tissue, that's all you need. This will not stain clothing. It's non-comedogenic. Bacteria can't grow in it. Lasts a long time. And as soon as fabric touches it, it's gone. So they won't have that greasy feel after your massage when you use this product. So you see I'm trying to keep contact with him. I just didn't take my hands off. Rub it together, keep that there, and then use this arm, this hand, and now come back and apply to this side of the body. Go under the arm because you're going to work under the arm. You may have to come back and apply some oil, but that's okay. Go all the way off the hand because it is attached. You're not coming down and stopping. You want to have that stroke feel complete, so you need to come all the way off the hand. Now, generally speaking, in our field, most massages are booked for 60 minutes, but the actual time on the table allowed is 50. Now, if they're late, something happens, very rarely do you get that full 50 minutes. So if someone is teaching you massage and all they're doing is teaching you one protocol, one formula to follow, you're going to have a really difficult time giving a massage because it's never going to be exactly the way they showed you, they trained you. And if you don't know how to make adjustments, if you don't know how to change your time, 1 minute, 2 minutes, 5 minutes, they wanted this done, they did not want that done. You're not able to do that. You're not able to do a really good massage. So I'd rather you not learn a formula, a one-size-fits-all way to do this. I'd rather you learn all the different strokes and techniques and then how to have flow between those techniques. Think of it as chess. If you're doing chess, you have to think ahead 3 moves, right? Well, you have to do the same thing in massage as well. You have to think ahead. What I'm doing right now is called effleurage. Effleurage is just anything that has a shear force to it. You're just gliding along the surface. You can do it lightly or deeply. You're going to avoid bony areas with any kind of deep pressure. So I'm very careful around the edges of bones and over the surfaces of thin areas. And this is just a straight effleurage. Now I can do it with just one hand. Open fingers, closed fingers, the heel of my palm, the edge of my palm, with my forearm, with my elbow, if I pick them up and work just with the tips of the fingers, this is called raking. This is great for going in between the ribs, or just moving the surface areas around. If one hand follows the other, it's called shingles. If you do it very lightly, it's called stroking, but this is usually called a nerve stroke or a feather stroke. Just very lightly trailing your fingers. Use the back of the fingers, the pads of the fingers, whichever way you'd like. This is usually something that we do at the end of the massage with the feathering. The powerhouse of the massage, what the Russians say is the most important one, and I agree, because what you're doing is you're wringing those muscles. You're taking that tissue, you're warming it up, you're stretching it out, and you're squeezing the fluids. You're trying to clean up those tissues. And like with effleurage, there's probably a million different ways to do it, but now you're going to be applying pressure in one form or another against those tissues. You can do it with one hand. I'm going along and grabbing and squeezing and pulling that tissue back into my palm. If I open my hand up completely, that's called a C-stroke. Broad areas like the back, that's perfect. Broad areas like the thigh. If I'm going to go into a smaller area, I want to pick up just a smaller area of the tissue, I'll keep my thumb closer, and that's called a V-stroke. Now I can do it by pushing with the heel of my palm. I can push with my MCP joints. I can grab with my fingers. I can just use my thumb. You can even do it with your forearm. So there's a lot of ways to apply this one technique, but as long as you're squeezing, kneading, putting pressure into the muscle, you are doing petrissage. Two-handed alternating. You're taking both hands and you're pushing into one area, back and forth, back and forth, back and forth, alternating. I can do two-handed petrissage, but one and then the other. I'm not alternating. One and then the other. Pushing it together. Doing a V-stroke. Maybe I just want to use those paraspinals. Get in there with the paraspinals. So I can change what looks like a shingles, effleurage, because one thumb follows the other. But because I'm rolling the tissue and I am squeezing them, it now is a petrissage. So we do something called cleaning up around the bone. So I take my thumbs and I roll them, one against the other. But because I'm making a fold in there, it's more of a petrissage than an effleurage. Now if I want to travel with that, I want to get that upper layer, that superficial fascia, loosened up a little bit, you can do it, it's called a skin roll. One hand, the thumb, one direction, the thumbs are rolling towards the fingers. So I'm holding my fingers still and I'm rolling my thumbs. But I'm making a fold in the tissue by pulling against the fingers. Then I can do it the other direction. I can keep the thumb still and roll it with my fingers. So you're rolling either way, thumbs to fingers or fingers to thumbs. And that's called thumb rolling. or skin rolling. To be a little more effective, you can simply fold it up and not roll it. So I would put a towel or something there, grab the skin and fold it up and roll it. Now you can have a petrissage that's more of a pressure type of petrissage. We would call that ringing. I can take the whole body and ring across the back. See, I make that fold in the middle. Or with the arm, one side and the other, pulling it back and forth, ringing it, or like this. You get more force when you pick up and push, push and pick up and push, pick up and push. Or trying to open up that muscle. I'm going to squeeze it, but I'm going to pull it away from the bone. That's called broadening. So if I take that muscle and I use all my force down, but you see how I had to step back? I didn't do it this way. Don't use your wrist like this. You're asking for trouble. Come back, lay it down, make it flat, because what's actually doing the work is the heel of your palm and your fingers. So you don't need to be up like that on your wrist. Open it up, broaden it out. Now the opposite of that would be lifting. So instead of pulling it apart, I'm going to push it together. You can do it one way, then the other, one way and then the other, or one and then the other. But this is lifting, pulling it up and squeezing it against itself, or broadening, flattening it out, pulling it away from the bone. Rolling it back. That's just a two-handed petrissage. There's no alternating. But if I do this on that one spot, it's still two-handed, but now I am alternating. Now I am alternating. On the neck, it feels great. You can pull with one hand and push with the other. You made that fold, you're squeezing, so that is a petrissage. And that feels really good. Pull and push, pull and push, pull and push, or simply squeezing with one hand, squeezing with the other. Now I'm going to alternate, do one and then the other, one and then the other, on the same spot, on the same spot. Effleurage is our beginning stroke, our ending stroke, our connecting stroke. So whenever we're working, we're always going to come back and throw effleurage in. Connect everything, warm them up, get those fluids moving out of that area with our effleurage. This stroke is hard to define. It's called friction. But what you're going to do is, rather than moving around on the skin, you're going to stay in one spot with the skin and move what's underneath. It's called a friction. So if I went right here, put pressure in, and went up and down with my pressure, I'm not moving on the skin, I'm moving what's underneath the skin. I'm going with the direction of the fiber, so this would be called longitudinal friction. This was popularized by Dr. Storm. Sometimes it's called Storm's technique. But whenever you're going with the fiber direction, it's a longitudinal. See, that looks different than this, right? It's not effleurage. Or I want to go across the fiber, which is your stroke of choice for scarring, for tendons. And now I'm going to go across the fiber. So I'll take my fingers and go like that, move what's underneath, and Dr. Cyriax is the one who popularized this technique. It's your stroke of choice for scar. Now I want to combine the two, kind of do them both, and I can do it in a circle. So I can hold that skin still, and I can make a circle with what's underneath. So you have three different directions. It's the same technique, but you do it with three different directions. With the fiber, across the fiber, or circular. And this applies really anywhere on the body. that you want to work, you can do friction. You want to do it along the edge of the scapula. You want to do it along the spine. You want to do it on the elbows and at the wrists and in the palm. It's a very, very effective stroke. And then the one that's the hardest to do, the hardest, is vibration. So most therapists stay with the easy part of this, where they just simply shake the person or they rock the person. Because this one is the one that, unfortunately, you do have to use your muscles. You do have to tighten up. You do have to shake your arm. Along the spine, if you open your fingers, you want to use these two fingers. But once again, remember to keep your elbow at your side, and you're just going to shake your hand. You're in that lamina groove. The lamina groove is where all of the sympathetic nervous system ganglions are, where the fibers can switch the signal that goes to the brain. And you have reflex points for the lymphatic system. You also have all of the meridian points. So this is a really important part of the body to try to do some type of work to affect a change, to help that person go into a parasympathetic nervous system and to balance the chakras and reduce the inflammation and the edema in the body. Because those are the problems that cause all of your disease processes. And that's the secret to helping your body get back into a more healthy balance, is to help all those go back to their normal state. We don't heal people. What we try to do is help the body return to its balanced state, and it will heal itself. So if I make it small, it's called fine movements. If I make it really big, it's called coarse movements. Now, if I did the entire body, which most therapists do this one, we call it rocking. Technically, it's translation. Technically, it's transverse or horizontal translation. So I'm just going to make his body, his whole body, go side to side. This is very relaxing. This is part of your inner ear mechanism to help the body relax and go into a parasympathetic nervous system if it feels this motion in the body. That's what will happen. And you can see you can do it a little differently, whichever way works for you, but let the body go at its own pace, its own rhythm. Some people rock a lot, some people don't. Now, if I do it the other direction, it's called vertical translation. So I can rock his body like this too, up and down. You can do it from the head, but believe me, it's not as comfortable and it doesn't work as well. Just hold their feet and move them back and forth. Gross movements would be shaking. And a lot of times, especially in the shoulder area, nothing else you do works. But if you shake them, it pretty much works. Keep your wrist flat and just do this. Or you can do it with your fingers. It's more tiring with your fingers, but maybe you want to do it a little more deeply. And sometimes, I mean, really, truly, this is sometimes the only thing that works. You can dig away all you want, but unless you shake them up, you're not going to get those muscles to relax. Shaking is a side-to-side movement. It's side to side. I can also do it up and down, and that would be called jostling. So if I want to jostle the arm, I'm just going to pick it up and shake it up and down. You can bring it off the table, or you don't have to bring it off the table. You can do it however way you want. Do it with a lot of force if they're really, really tight. They're really holding. So up and down is jostling, side to side is shaking. Side to side is... Now, you can combine these techniques, and you should combine them. So I might want to add a little vibration to my friction. I do a little circular friction and I vibrate. I do a little circular friction and I vibrate. I can be going up the spine, and instead of doing it straight, I'm going to add a little shake to it. So combine them. Throw them in so that they feel more connected It's not like you're going down the list. Well, first I efforage, then I petrissage, then I friction, then I do a little vibration, and now we're going to do the next one. It's not like that in a massage. Okay, please don't do that. If they can lay there and anticipate what you're going to do next, you're doing something wrong. A lot of therapists don't do this stroke. They leave it out, and they shouldn't, because applied correctly, it's very, very relaxing. And a lot of your clients aren't going to be going to bed after the massage. They have to get up, they have to go back to work, they have a dinner they have to go to. They don't really need to be in Never Never Land after your massage. So you can bring them back up a little bit by this stroke. It's called tapotement or percussion. And anything that strikes the body is a percussion. And I can do it to sedate the person or to wake them up. It's all in the technique. So you have to know how the body's going to respond. If I hit you hard and long, it's going to sedate you. If I hit you lightly or short for a short period of time, it's going to wake you up. It's going to wake you up. So maybe you have to get back up after your massage and go do something. So the last thing I'm going to do is kind of bring you back up. I'm going to do some light all over the body, fast tapotements to get you back awake. If you really have a low back problem and you really have a shoulder problem, I really want to knock that out and help you relax. So I'm going to do it a little bit differently. It could be the same technique, but how you apply it can be different. So there's a couple of different ways to strike the body. The one that's the most effective is called cupping. You're going to make a cup with your hand. It should sound like this. And that creates a vacuum between the palm of your hand and with the air, and it sends a shock wave into the body. So it's very, very effective. You never want to do tapotement on bare skin. Think about it. You're stinging the skin. You need to cover them back up if you're going to do tapotement. Please don't do it directly on the skin. If you don't want to pull the sheet back up, you're doing something else, you can always put the towel there when you're working. But you want your cupping to sound like this. You can do it alternating or together, or one hand and then the other hand. You can go back and forth. One and then the other. And don't forget the feet. The feet love to be hit. They can take it. Most effective. The next one is the one that everybody has seen in all the boxing movies. They go back to the corner and their trainer comes out and he starts doing this. This is called hacking. You're going to hit them with the palm, the ulnar side of the palm. So it's not fingers, it's this part of the palm. Very loose. Hacking. I can do it very fast, I can do it very slow, I can do it very deep, I can do it together. So how I apply it, how I vary it, is because I have a certain result I want to get. Just like with a chef, I have to know my ingredients and I know how to put them together to create the dish that you are going to enjoy. So hacking is the ulnar side of the palm. Slapping is just what it sounds like. You slap them. Beating, just what it sounds like. You make a fist, but you don't tighten up. It's not you pounding them. It's your body hitting them and then bouncing back with the rebound. So it has to be nice and loose. No tight fists, nice loose fists, alternating together. You can go back and forth and create some kind of rhythm for what you're doing. Mix it up because the body is going to keep reacting rather than accommodating. You don't want to do the same thing, completely repeating it like that. Tapping is instead of beating, you use your fingers. This is the only one you can do on the face and the scalp. I know you'll see it in some videos, but here in America, don't do anything else, just this. But this is good for smaller areas. But if I do it hard enough, I can do it into the hip to where it's effective. So beating, tapping, slapping, hacking, cupping. Some little fancy ones that most people don't use, but they're there. One is called scrunching. And you're going to do a little pinching movement, like you would spin a top, with your thumb coming off your fingers. Do like that. It's a little pinch. Now, I've read that Julius Caesar had epilepsy, and he had his physicians do this to him every day, maybe several times a day. They seem to think it helped because it does stimulate the nervous system and helps balance it, and you just do a pinch. This works great, kind of a variation on the face, but you can't do it really hard. There are some people who claim that this works with cellulite, to pinch and break up the cellulite. Just remember, here in America, you have to be very careful about your claims on changing the structure of the body and especially cellulite reduction. I think there's only one FDA-approved method, which is called endomology, and it uses a machine. And you as a massage therapist are the only profession who's allowed to operate that machine because you're working the soft tissues of the body. But for you and I, we can say contouring, but we really can't say, I'm going to get rid of or reduce your cellulite. Although in Europe, it is used as a therapy. Scrunching is just a little twist. Without the twist, it's just pinching. So if I just grab and pull, I'm pinching. Grabbing and pulling, pinching, twisting is scrunching. The one that the Oriental, all of the Eastern paradigm therapies and modalities use is called, we call it quacking. I'm sure they don't call it quacking. But you're going to put your hands together with your fingers loose, and what you're going to hit them with is your fingers. And because your fingers are loose and slapping up against each other, you're going to hear a sound. This one you still have your elbows at your side, but you are bringing your arms up to 90, and you're going to twist your arm up and down and hit them with your fingers. That makes a totally different sound than if you're hacking. Hacking is down here, quacking is up here. Loose fingers up and down, hit them with your fingers. Once again, vary it. Have some slapping going on. Back and forth, beat them, cup them, whatever. Mix it up and make it enjoyable. If it's something you're doing to help them wake up, you could go through the body with some deep, heavy tapotements, but then the last thing you're going to do is you're going to bring them back up with some light, striking, fast movements to help bring them back awake. Okay? Now, what we like to do is we like to make the experience very enjoyable for the person. So we want to include some warm towels. So once I've done the work on the back and I've used all of my strokes, I'm also going to include some range of motion. Now, I haven't shown you this yet, but remember, it's not just your hand that you can use. Your forearm is a very, very good tool. Your elbow is, if you're careful and you know what you're doing. You don't want to use your hand for everything. You're going to ruin your hand. Don't wear it out. Don't use your thumb for everything. Use it very, very sparingly. And use it in the correct position. The correct position. That is a compression joint. It can take pressure as long as it's done in a straight manner. But you start putting pressure into the joint at an angle, and you're going to ruin it. So you have to keep it straight. You have to keep it close to the palm. So don't be working your thumb with it out like this. Keep it close, or bring your fist around and support it from underneath. Or use your tall finger. It doesn't have that saddle joint. It can take it, and you really can't use it anyway but straight. And it doesn't wear out. It doesn't cramp up on you. It doesn't get tired. And you can have just as much force and maybe more because you can get directly over your tall finger rather than your thumb. The alternative, of course, is your elbow. But with an elbow, you don't have the sensitivity you have in your hand, so it's a little harder to judge how deeply you're going or where that elbow actually is on the body. So I recommend you learn to use your other hand around your elbow to guide where your elbow is, especially until you become familiar with it. Never do it with a clenched fist. Feel the muscles. It feels totally different if you clench. You want to leave your wrist loose. And you want to keep your elbow at your side. But learn to use your elbow. Don't rely on your hand for everything. Don't rely on your thumb for everything. This is a pointy surface. You can go deeply with it. Feels great if you know what you're doing. Using your forearm, you want to grab your wrist, keep your hand facing down, pronated, so that you're using this side of your forearm. There's a muscle here called the flexor carpi ulnaris, and that's the muscle you want to use for your work with your forearm. If you turn it up into neutral position, you're on the edge of the bone, the ulna bone. It's very sharp, it's very painful. If you try to do it this way, there's really nothing back there. You want to be on the soft muscle and you want to be close to the elbow. You don't want to be applying force out here because now you've lost the ability to push with the back leg. There's no force coming from your body, it's all coming from your shoulder. So you want to work right here. Now on the back, a good position to be in is to sit down, taking weight off your legs. So we're going to take his leg up and we're going to hold the bottom sheet and his arm, or use a towel because you're never going to touch their skin directly. And you're going to put that arm across your leg. Sit comfortably. Ask them if they're comfortable. Now I can work on his back with my forearm, and I've got my back leg is pushed out to the side. I'm pushing against the ground. And I'm not having to really work hard at all to do this. Is that okay? Mm-hmm. And with my elbow, I can work into it. A few strokes with the flat of the forearm, and now I can go a little more specific with my elbow. I can bring it down around the hip on that quadratus lumborum muscle. Come back up, stay on those paraspinals. And the higher up I come with my forearm, the more pointy my elbow is, the more specific I am to one spot, and the deeper I can go. And all I'm doing is pushing against that outside leg to give me leverage. Put the arm back. I have stretches we'll do, but we're going to do that in a different video. If you take the arm off to range the shoulder in this position, it's different than the other position. I showed you before. You go pick it up like this, lay it across the outside of your forearm. In prone, because of the shape of the shoulder, you cannot bring that arm up higher than the head. It's not comfortable. It's going to hurt the shoulder. So I'm holding elbow and wrist again. Bring the arm out. I'm going to hold it here and let it just rest and keep it below their head. So you're not doing this with the shoulder. You're not doing this like you did when they were supine. You have to let it stay loose and just support it either at the wrist or the elbow and let it come below the head. Or you can put it back on the shelf. So if you have that little shelf or you have the stool, now you can let it go, but at least it's lower than the body and it's not uncomfortable and you're not hurting the joint itself. So if I wanted to do some really deep, long strokes and stretch out those muscles under that shoulder, get all those little teres major, minor muscles in the lats, I can lift up, but the arm is supported. It's lower than the head and it's comfortable. I'm not hurting them and I'm not damaging the joint. And then put it back to the table. The lower body is a little easier to work on because it's round and you got thick muscle to work on back here. You don't have to worry about bones. But all of the strokes are going to apply. So I'm just going to move this out of the way for demonstration purposes. Now, if you have a hairy person, you're going to have to coat that hair first before you start working on it. So your first stroke is going to be with the growth of the hair. I don't recommend you put oil in chest hair. I mean, a lot of guys are really hairy on the chest, but don't even try to go there because that's the most uncomfortable thing in the world when they get up and put their shirt back on and they're kind of coated on the chest. So you don't need to use oil. There's work you can do without using oil, so I really don't recommend you do that. But legs, yeah, okay. So we're going to go with the direction first to put the oil on. So it's all coming down the leg in the beginning. Now I can go back and put more where I want it, but just like we did before, we don't want to lose contact. So I'm just going to turn my hand over, put more oil on, and go from there. So this is the effleurage. This is the beginning stroke, the connecting stroke, the ending stroke. I can add a little more pressure by reinforcing with my other hand. I can do shingles. I can rake. Then you can go into your petrissage. These thick muscles can take it. You need to squeeze them. You need to get them cleaned up, get all those fluids moving in and out, and open those fibers. I can use my fists to effleurage. I can use my fists to petrissage. I can do ringing. I can do just two-handed, circular, pulling it together. I can do broadening. Do not go into the femoral triangle. I still have to avoid that area, but I can go up higher with the outside hand. And lifting. I can do my thumb rolling petrissage to get those tendons behind the knee. This is called bent knee position. See how loose the muscles are? You always want the muscles in their most relaxed position. So if I really want to get in there and go deeply, I should bring the knee up. Those muscles are stretched across two joints, so I want to eliminate one of those joints by bending the knee. Now I can work much deeper, broadening and lifting, ringing, using my fists, doing frictioning around the tendons, rolling thumbs up, a little jostling, ranging the knee, ranging the hip, and putting the leg back down. Now, a version of the petrissage that some people put into its own category, it really isn't its own category. They call it compression. You're still squeezing, it's still petrissage, but you're doing it more still. So if I just take the muscle and push down and squeeze it, compressions, that is a form of petrissage. It really isn't its own category. It's kind of a static broadening. And sometimes you want to do this along the ITB band on the outside of the leg. You want to stretch that out. A lot of people are very tight there. You're going to put your thumb behind it, posterior to it, and you're going to lengthen it by pushing down towards the table. So you're taking that band and you're pushing it down to make it longer. The feet. Every stroke can be done on the foot that you did everywhere else on the body. Some people love their feet being done, some people don't. Most people do. So my recommendation, be good with hands and feet and they'll follow you anywhere. A lot of people will come in and they will insist that you just do the foot. Some people won't want you to add it in, but most people do. So how you add it in is going to mean a lot too. When do you add it in? How do you add it in? How much time do you give to the foot? If that's what they really like, then you want them to remember that. So you should do it in both positions, but it should be the thing that you end with. Whatever they said they wanted, they liked, you should have that be the last thing that they experience so that they can remember that you remembered what they wanted and you made it what they wanted for that massage, which was a memorable treatment of the feet. So you can add your effleurage. Can you tapote? Can you petrissage the feet? Well, of course you can. You can pick them up. The best one is ringing. Ring the whole foot or ring the instep. Frictioning is really good. Most people suffer from something called plantar fasciitis. The arch of the foot is a big tendon, and a lot of times the shoes we wear or the way we walk puts pressure on the attachment site here at the calcaneal bone, and they get inflamed. This is ensheathed in a little membrane, which is the synovial membrane, the very same thing that's inside a joint and also a bursa. It's all around that tendon as well. So sometimes it's the tendon that's inflamed, but sometimes it's that sheath around it that's inflamed. And you have to treat them a little differently. If you're treating the sheath, you need to put the foot, tighten it, and you're going to do your longitudinal friction to help loosen up and get some of the fluid out of that membrane that's around the tendon. If it's the tendon itself, you're going to want to do deep transverse frictions. Deep transverse. And usually at the heel is the better position to do it in, but you can do it down the whole length of the fascia. But then to strip it, you're always going to want to bring it back from insertion to origin, okay, to help lengthen it out. Remember, the feet like to be slapped and squeezed, and anything you want to add in there, make it enjoyable for the person. Be careful of the toes. If they have any kind of problems with their toes, there's deformity in there. Don't be hurting them, pulling on them. And you have to be aware of the person's feelings too, emotionally. If they feel self-conscious of their feet, don't draw attention to the fact that their toes are malformed. You're trying to dig around in there and pulling them and you're having an awkward time of it. Now, instead of being relaxed, they're totally aware of the fact that there's something wrong with their foot. So you don't want to draw attention to it. It's better just to not do anything than to embarrass them or make them feel uncomfortable. And you want to look for ingoing toenails, so no matter what you're doing, you never touch the nail. Don't squeeze the end of the foot, don't squeeze the nail. And if there's a problem there, avoid it. They may have bone spurs in their foot. The best way you'll know is they will pull back or they'll tell you ouch. But if you feel something hard in there and pointy, don't try to get it out because you're not going to be able to get it. It's bone. Leave it alone. If they have a growth off the edge of their big toe, it's called a bunion. That's bone. Don't irritate it. You can do a little stretching to help get the fluids moving, but just please don't work on it directly. Don't work on it directly. If you have an elderly person, you may not want to do a lot of the different things that we're looking at right now. Maybe modify them a little bit. If they have osteoporosis, you certainly aren't going to be doing any deep work on them, any kind of pressure work. Sometimes women are a little more conscious if they have loose skin or they're a little overweight. So maybe you should be careful what kind of shaking motion you do with them. If they feel like you're shaking them and making those turkey wings on their arms stand out, now instead of relaxed, now they're embarrassed. So you have to use good judgment as a therapist with all of the different techniques at hand. So you have lots and lots of tools, but you're not going to use them all, and you're not going to use them all the same way on different people. So your client started face up. This person started face up, and now we're done with the massage. And what they really wanted was a full body massage and they wanted their back done. So I would have started with the legs, and the last 10 minutes of that massage, I'm going to really make that back feel great. If they said they wanted to start face up, but they really like their feet done, I'm going to save a couple of minutes after I've done the back, before I'm done completely, and go back and do the feet again. I may have already done the feet twice, but I'm still going to go back and do something to kind of tie it all into the feet. Now, if they had started supine, face up, and they ended in this position, you're going to do all of your warm towels now. But before you turn them over, you are going to put a hot towel on their face. Some people want their face massaged, some people don't. If they don't do it. Don't insist. Don't say why not. It's not your massage. It's not. It's theirs. The only time you should try to suggest or recommend is if there's something that's going to be detrimental to them. First, do no harm. So if it's something they want but you don't feel it's safe to do, then you have to say something. But otherwise, if they don't want a face cradle, they want a pillow, it's not my place to ask why or to insist that they use the face cradle. Because that's how I was taught, and I don't know how to do it any other way, so you're going to have to do it my way. That's called countertransference, and we don't do that. It's theirs. It's their massage. And I need to know enough to be able to do that for them, to change what I'm doing. And some people are claustrophobic. You know, they just don't want to put their face in that hole. Am I going to judge them? No, it's not my place to judge them. And I don't need to know the facts. If they start crying on the table, I don't need to know why. I am not allowed by law to ask why, and I'm not allowed to counsel them. I can wait and say, would you like to go on with your massage, or would you like to stop? Would you like to take a moment? And that's as far as I can take it. So we have to be very careful. We don't need to step outside our bounds. There's a lot we can do. We don't need to make it more than it is. But you're going to want to end your massage with something that you did at the beginning. So if you started your massage with a deep breath and a stroke on the back, you can do it through the sheet. Okay, hon, I want you to take a nice deep breath in for me and blow it out. So I'm holding the sheet and I'm going to stroke down his back and I'm going to stretch his spine out. So there's continuity to it. There's continuity to my work. And I'm going to do some hot towels. Hot towels. Where are they? Now, get your drape out of the way because they're going to have to go back and lay there for a few minutes before they get up, or a few seconds. And I don't want to get the towel all over the sheet, so now there's a cold, wet sheet that I put their foot back down on. So I'm going to bring this up out of the way. And after I've put this on their feet, I can pull it back down. You want to fold your towel lengthwise. Keep that fold side up. Is that okay?
Yep.
Okay. Hold it tightly and wrap it around the foot. That one okay?
Uh-huh.
Okay. The temperature on the back, you're more sensitive in the low back, and it's kind of a, which way do you go? If you put it up here, then the body's already responded to the heat, and it doesn't feel it in the low back as much. So what I like to do is I like to ask, is that temperature okay?
Yeah.
Okay. But then I'm going to start at the top and go down. Because your back can take it at the top, but not so much at the bottom. You can do a little bit of stretching. Take those paraspinals and move them away from the spine. Whenever you're going back and cleaning up a little bit more, be aware of the edges of the towel. They're cold and wet, so you don't want the person touching that part of the towel. So I'm going to keep all that away from him. Remember, keep the shoulder below the head. Bring the hand off a little bit. Oops. Below the table, below the head. Put it back. Now, if it's someone who really does not want the oil on, they just feel they don't like having that oil, you can take the alcohol and give them an alcohol rub at the end. The alcohol is really the only thing that's going to cut oil on. Anybody says it really is. A little bit in your hand, warm it up, effleurage it in, and then go back and compress it either with the towel or with the sheet. But you can come back and do this for everyone just to get a little bit of that oil off and do some effleurages to help remove it. And it feels good to get the blood going back into the body just with the little compressions. All right, this is a more difficult way to get someone up off the table than if they were supine. So we're going to have to do it in a little different way. Always make sure their feet are uncovered. You can get that bolster out. You can ask them to turn back over onto their back before they get up. Everyone, no matter how healthy or sick you are, should always get up in what we call a log roll position, which is on your side. And unless this person has some injury to their shoulders, there's no reason why they can't get up from the log roll position. So they don't need to turn over completely. All they need to do is turn onto their side. So whichever side of the table you're on, you want them to do that. Now you want to lower the table, but if it makes it easier for you, for them to sit up in this table height, that's fine. But before they get off the table, you need to lower it so they don't have to jump. Their feet are going to touch the ground. Now, if they have sandals, like you're in a spa where they get a bathrobe and they get sandals, you can always bring it over to the table for them. Which you could do even if it is not sandals, just whatever. Bring their shoes back so that their feet, especially in here, we have tile. The floor is cold. So after that nice, warm, wonderful massage and those hot towels, they stand up and they're on ice cold tile, which is not very pleasant. So put a towel there for them to stand on. Bring them their shoes. Do something. You're the therapist. You have to think about these things. This is your client. Their comfort, their enjoyment is your responsibility. So every little part of it has to be something that you have thought out thoroughly, to where you're not going to hurt them, you're not going to jar their nerves, you're not going to put them on alert. They're going to be able to enjoy the entire experience and go out of there. Maybe there's not one thing they can put their finger on, but there's just something about your massage that makes them feel so much better than with anyone else. And even standing up from the side of the table, remember that's still part of their experience, so you have to think about it. So in here, I'm going to bring his flip-flops over, or I'm going to put a bath towel. I'm going to do something so that he doesn't have to step onto an ice-cold floor after having hot towels put onto his feet. So we're going to bring this right here. Now, it's easier for me to have him sit up with the table here, so I'm going to have him sit up first, then I'm going to lower the table. You're going to ask him to turn on his side just like you would have done to have him turn face up or face down. But because he's on the face cradle, I may ask him to scoot back just a little bit first. All right, Tony, honey, I'd like you to scoot down towards your feet just a little bit. There you go. And then bring the shoulder up. Turn on your side facing me. Facing me. Great. Okay. You want to bring that top drape against their body, especially if it's a woman, kind of like a toga. They're going to put their bottom arm down with their elbow bent. They're going to put their fist not against the top drape, but against the bottom drape. If you do that, you're going to bring it with you, and you don't want to bring it with you. You want it to stay against their body. Bend your knees up. Uncover their feet. You're going to tell them that you're going to bring their feet off the table at the same time that they're going to push with their fist and their elbow. And you're going to sit up. All right, I want you to push with your fist and your elbow, and we're going to swing your feet. Push, and then sit up. Notice I grabbed the drape. He or she did not have to worry about the drape. It came with them, and I made sure that it came with them. Guys, you know, they don't care, but a woman would care, okay? You're in a room alone. There's nobody behind them. Nobody's going to see the backside of their body, so you don't have to worry about that. But you do have to worry about this. Now, I need to know where this little foot pedal is at all times, because I'm in control. And then this gives him a chance to kind of get his bearings, have his blood pressure regulate a little bit. He didn't jump right up off the table as soon as he sat up. And then I can kind of look at them and make sure they're okay, look in their eyes, and explain that you want them to get dressed, and you'll be right outside with some water and to come out as soon as they're ready. Okay? Okay.